Hi, I'm Dr. Kevin Cheng, founder of Osana, a health service dedicated to transforming lives through prevention. Over the years, I have reflected with colleagues on what we wish people did so they can avoid pain, surgery, or developing a chronic disease. Often the answer lies in embracing a proactive mindset and putting healthy lifestyle practices into action. By doing this, the upside is not only better health, but also saving us time, money, and stress in the long run. In this podcast, I'm joined with my friend Saxon Piggott to chat with a new health expert each week. We'll cover practical ways to look after ourselves, how to prevent illness, and ways we can be inspired to live well. Welcome to Prevention Hacks, the weekly conversation where we go to health experts for advice, so you don't have to. Welcome to Dr. Raj Anand. Welcome, Raj, to Prevention Hacks, which is Osana's podcast. You are a consultant physician in general medicine, rheumatology, and also in pain medicine. And we're going to be talking about chronic pain today. And this is a topic that you know very well. You run projects with the New South Wales Agency for Clinical Innovation. You're on the Australian Pain Society. You also lead projects with the International Association for the Study of Pain. So welcome to the podcast.
Thank you, Kevin. It's been a pleasure to join you guys and an opportunity to discuss about something which I'm very passionate about.
Raj, what's the difference between pain and chronic pain?
Pain in general, I think coming back to what is pain is a very important thing. And very recently, there's been a change in definition of pain. So maybe it'll be a good place to start over there. And pain has normally been considered as a sensation or when a nail is hit into, or when you step on a nail or touch a hot pan, then we experience pain. And there are many times we experience pain where there is no particular cause, whether it's low back pain or chronic widespread pain. And pain has always been looked on as an alarm where the body is at threat. Whether it's a danger, whether it's true or a perceived threat, that's the common message, what it passes through. But also very early on, it has been noticed pain is just not a sensation, but it's also an emotional response. And pain is just not a direct pathway of one nerve getting stimulated, but it's the nerve which takes these chemical and electrical responses from the body. It goes through our spinal cord into our brain, where it goes through different parts and it finally interprets that message, which is called as pain. So the definition goes by saying it's an unpleasant sensory and an emotional response to a perceived threat, which may be true or which may be something which our body is trying to alert to. And in the past, it was always said something which we described, but we know that people who are not able to verbally communicate they're in pain still can experience pain, and this applies to people who are either unconscious in the intensive care units, or people with dementia, or animals, or even infants and children, where they're not able to communicate, they still can experience pain. So that's the basic framework with which we deal with pain. And coming to chronic pain, there's a huge lot of definitions on what it means. And it's basically based on a timeline, is what we would say. If the usual definition is if the pain persists for more than 3 months, it's kind of with where the cause has not been clear or the usual treatments have been applied, then you call them as chronic pain.
So it's pain that lingers.
Yep, that can be one way of saying. But again, it's a continuum. Sometimes it could have been present for one day, but there are risk factors to say this is something which may be persistent for a long time. So sometimes the definition of chronic pain has its own attached stigma to it and attached fears to it. So again, it does have some value, but at the same time, we'll have to see what are the downfalls of having the terminology or a diagnosis of chronic pain.
We see pain as a very common presentation in all of our Osana clinics. And as we have an aging population, there's more arthritis, I suppose. So aches and pains is quite a common concern or issue in a lot of our patients and members, particularly those who are older. What would be the natural course of pain as it evolves? And part of this question is also, what's the worst that can happen to someone if you don't treat it well?
It's a very broad question to answer. I mean, the reason is pain can be present at many places. I mean, if you're dealing with chest pain, then I would definitely say call up the ambulance or seek help, seek from your doctor. But again, every chest pain doesn't mean it's coming from the heart. It can be coming from your ribs. It could be coming from your back itself, the spine and the thorax, or it could be coming from the neck. So again, there's always, when it comes to pain, it's always good to discuss with your health professional just to see what could be the possible causes. Is it something which is posing an acute threat, especially if you have any fever, or if it's a pain which started after a fall, and where you think the pain is out of proportion to the cause of fall. Or you're not able to move a limb, or there's any change, if you're sweating or you have a high heart rate. These are all changes or fevers. I would say definitely contact your general practitioner or your medical team sooner rather than later. But coming to aging and pain, I think a part of it is a myth. It's not necessary that as we age, our pain levels increase. Yes, we do notice increased aches and pains, which has been shown in prevalent studies, but our neural systems too kind of adapt with our aging processes, and the way the pain processing system senses response to change. There are many changes which we notice, particularly in our spine and our joints as we age. Sometimes we do term that as osteoarthritis, and the thing comes as how much of that is just a normal physiological response of our body, and how much is pathological. And sometimes there's a fine line over there. And also there are changes within our muscles and the ligaments as we age, and our nervous system too, which all lead to a combination of increased pain. But also one needs to be a bit more aware that our internal organs do change with age. So the medications and other things we take may not be the same as what we give to someone who's much younger, because they can have other side effects.
Is there anything people can do at home to help manage their pain? Is there any advice you'd have?
Absolutely. I think there are, if we today look into Google, there are numerous, or in a search engine, there are numerous remedies for pain. And I think everyone have their way of managing pain. One of the most common and simple things which does help with pain is to keep moving, and keep moving that part of the body. And just not that part of the body, but moving the whole body is the most important thing, particularly when dealing with chronic pain. And chronic pain does not necessarily affect one part of the body, or it's not, even though the pain might be in a little finger or the toe, it affects that whole person. It affects their way they interact with their family, their life, their work, can interact with their moods, their sleep. So the impact of pain is much wider, and trying to keep moving. And as we move the body, we are also moving the mind at the same time. And that's probably the most important thing. The single most important thing is how do we keep moving despite the pain, and not letting it limit our daily activities in whatever form it could be. It doesn't have to be a long walk, could be just a minute or two, but keep moving is the single most important thing.
I found that sometimes because pain is so complex, Raj, sometimes distraction or being sort of mindful, and I know that you're a trained instructor in mindfulness. And so what would be, 2 or 3 things that you wish every patient would do before they come and see yourself or come to a pain clinic?
Yeah, absolutely. I think, definitely kind of having a bit of an understanding of what they're going through is always important, because sometimes we lose meaning of what this pain is indicating, and many times within our normal community, but within the professional and in the society, when people are not able to find a direct attributable cause, then they say your pain is psychological or emotional. But all pain at one level has common pathways. So I don't think there is any point in differentiating one pain to another. Coming back to diversional strategies, again, it's about seeing what ways they can help move in along with the movement, whether they want to use music or whether they allow walking in nature or even just looking out into the plain sky or the sea, could all be important ways of dealing with pain. But just recognizing what are factors which could be making their pain intensity high is probably the first step. Is that pain, whether it's in the knee or the hip, is kind of influenced by factors beyond the pain and the hip. And that's the very first thing to acknowledge is the pain response and processes extend beyond the body part where they experience pain. We do know from different studies, like even just cutting off a limb or something may not necessarily solve the problem of pain. And that comes even with joint replacements, like particularly with knee replacements, even though when knee joints are replaced, still 30 to 35% experience what we call post-surgical pain. So all of this kind of brings back into how can we allow our own body to kind of reduce or maybe even reduce that interference of pain or what comes into our attentional mechanisms. And that's where these diversional strategies and mindfulness strategies become very helpful. Many times pain can set off a whole lot of subconscious responses like the fear, the anger, the guilt, or bring on other features of loss and sadness. So just being aware of that is probably the first step. And our brain has this capacity to kind of quieten down a lot of these sensations. What's a part of the back of the brain, or what we call the descending part of the brain. And that's where a lot of our diversional strategies is one of the proposed sites of mechanisms on how even the breath, like when we have a lot of pain, just even taking slow, deep breaths
Right.
would be a start.
I was just going to follow up and ask, if we don't treat pain well in a chronic pain, scenario, is there evidence that, not getting in early preventative treatment will actually lead to a worse outcome?
Definitely, yes. I mean, I think there's a whole lot of studies going on how do we prevent the transition from acute to chronic pain. When they mean acute is usually pain of lesser than 6 weeks to 3 months type of a thing in acute onset. And how do we prevent? And again, what they do notice is the onset of pain or how long it persists may not always directly correlate with what we see on a radiological finding or what we see from a pathology point of view. Yes, a greater surgery can lead to higher level of pain, but it's not always very concordant. And there are different factors which can predispose to why it leads to chronic pain. Two things. One is chronic pain has a huge burden on a person's life, whether it's sleep, mood, their ability to participate in their preferred choice of life activity. So it's a personal huge burden on them, but also the different interventions people try can have a lot of side effects or even delay getting a right treatment. And I mean, as I said, whether it's a choice of a medicine or whether it's massage therapy or a movement-based therapy or whether it's an intervention, sometimes it's about, there's no one answer to say, where is the switch off button for pain? And many times using that analogy, okay, pain is in the back of the knee, so let me just remove or get an operation on the knee, may not necessarily fix the problem of pain. And it's about thinking, what else can we do? How do we address it even before we proceed for any intervention? And what do we do after the intervention? How long do we monitor it? And so that's where it becomes very important to have a good understanding on what all could be factors, even in acute pain scenario, to kind of see how do we best treat it. And if things are not going as per plan, how do we introduce other strategies as we go on?
Raj, I was going to ask you about the different options. Do you think a holistic approach is the best approach? Do you attack this kind of problem from a lot of different angles at once, or do you try different things and see what works? What's your approach?
I think definitely, most people try the simple approach, but coming to pain, always, at least by the time they come and see me, it's usually a much more multimodal approach. And the way sometimes I look at it is there is a soup of issues. It's not as simple as like remove the salt out of the soup. In a similar way, it's very, very hard to kind of target and say, let's remove the pain and my life is completely fixed. And it's never that scenario. So it's always about looking in a multimodal fashion. How do I improve that person's sleep? How do we improve their interaction? How do we allow them to dress up by themselves? How do we look into the medication use, the side effects of the medications? How about the energy levels, the other issues associated with it? So definitely a very multimodal approach. And I think even applying those strategies very early on become very helpful. Because the longer we leave the nerve more sensitized, and leads to more layering and more unpacking to be done later. So again, putting on a whole lot of measures even early on still become helpful. Even like putting a heat pack may appear like a simple step, but again, even that's one type of a diversion mechanism. But we can't rely on one strategy because nerves find other ways to communicate the message. So that's something which I would say every one of us to probably develop as what do we have a whole range of tool sets of diversional tactics. It could be art, it could be mindfulness, it could be going for a walk or going for a swim. And when we're not able to do a sport, for example, can be a great way of diversion. But when we're not able to play that sport, if that was the only way we were our way out, then we're going to be stuck. And so that's where having a whole range of ways to deal with it definitely become very important.
And thanks so much, Raj. And to kind of maybe finish up on, looking forward into the future, are there any exciting developments that you're passionate about that would, may potentially change the way chronic pain is being managed and out in the community or within the health system?
I think the biggest change is the more multidisciplinary setup of practice. I think that's the biggest single change. I mean, we know there's a lot of innovation happening from both interventional and medicinal aspects of pain, like with the introduction of cannabis, which still remains a big topic on its own right, and probably we should have another podcast to discuss it. It's a whole thing of unknown.
We'll definitely do one on cannabis.
Which is very topical, but again, there's a lot of unknowns there, or coming to interventions such as spinal cord stimulators and radio frequency. So there's a lot of innovation research going there. But I think it's still about stepping back. I don't think there is one single switch off button that's going to fix the problem of pain. The only way to kind of deal with it, which has been recognized right from over 50 years ago, still not come so much into clinical use, but I'm hoping with the COVID and everything, the increased use of technology and telehealth would lead to more interdisciplinary care, better communications between the person, the medical teams, the allied health teams and specialists is where we're going to see more success.
That's exciting, and it's very aligned with what we're trying to do at Osana. So thank you so much, Raj. Look forward to having you back on the podcast on another topic. And meanwhile, Sax and I will work on diversion therapies and exercise when we compare our stories around sore backs. So we'll work hard on that, and then we look forward to catching up with you soon. Thanks so much.
Thank you, Kevin.
Thanks, Raj. I want to hear more about medical marijuana.
Absolutely.
Thanks.